Good day everyone, my name is Kenneth D. Velasquez, a student nurse from Davao Doctors College, and today I'm going to perform my written demonstration on how to take the vital signs of a client or a patient. So vital signs are basic body measurements that are helpful in assessing the client's conditions, and they also serve as important indicators of client's health status. So before we proceed to any further, first, we need to verify the need to perform these assessments, and this could be done by checking the history of our clients or reviewing the patient's data. So now I'm going to check the data of this specific patient, and okay, so upon checking this data, it shows here that this specific patient has no any other past medical records here. So after verifying the need to perform the assessments, we will now proceed with the preparation of our equipments, and the things that we need to prepare are, of course, the thermometer, this is digital, the sphygmomanometer or the BP apparatus, the cotton alcohol, which will be here, the notebook and pens, which will be here, and then of course the wristwatch that has a second hand on it, and of course the completeness and organization of our equipment ensures our efficiency as nurses rather. And now that we are all set, we can now proceed to the patient's room and start our procedure. Hi ma'am, good morning! Kamusta man ka?
Okay lang ka, nurse.
Okay, maayos. Sige. So, pwede ka mo baling dire? Okay lang?
Okay, sure.
Sige, wait lang. Wait, kulis lang. Sige.
Okay.
Wait lang ha. Okay, so I am now in the patient's room. So, I can now assess the vital signs of the patient. So, prior to performing the procedure, I need to introduce myself, and I also need to verify the client's identity. So I need also to explain to the clients what I am going to do, why is this assessment necessary, and how the patients can cooperate to this assessment. So ma'am, good morning. Ako din si Kenneth Velasquez, your student nurse for today from Davao Doctors College. So may I know your full name, ma'am?
Robbie May Arantua.
How about your birth date, ma'am?
October 21, 2001.
How about your age, ma'am?
19.
Okay, thank you very much for this, ma'am. Okay? So, pwede na ko matanaw, ma'am, imong
sure.
wristband. Okay. Okay, sige, thank you for that, ma'am, ha? Okay. So, unsa man imong gusto itawag na ko sa imo?
May.
May? Okay, so Miss May. So, how's your day going so far?
It's good.
That will be very nice to hear, ma'am. Okay, and I
Thank you for
really hope that our day will end up a good one. Okay. So, karon di ay ma'am, kuhaan na ko imong vital signs, mama, okay? So, kuhaan na ko imong temperature, imong blood pressure, imong respiratory rate, or of course, your pulse rates. So, gamiton po di ay na ko ni ma'am kaning stethoscope, kaning sphygmomanometer or the BP apparatus. Nakakita na ba ka ni ma'am?
Yes.
Sige. And also, ma'am, the usual thermometer, okay? And the cottons and all. So, this is for the patients to lessen anxiety and promotes cooperation. So, I also need to verify the client's identity because I need to ensure the care is being rendered to the correct client. So, I have explained the procedure to her a while ago, and explaining this procedure to the client can reduce the client's anxiety and enhance cooperation. So, okay, so now I need to perform hand hygiene or hand washing and observe appropriate infection prevention procedures. So, ma'am, mag-alcohol lang sa ako, ma'am, ha?
Sure.
So, this procedure is very important to reduce the transmission of microorganisms, okay? So, provide for the client's privacy. This is to maintain the dignity between the patients and then the nurse. So, providing for client's privacy protects the client's integrity and enhances comfort. Okay? So, karon ma'am, kay i-adjust na ko ng cortina ha.
Sure.
Ilak lang sa pud nako ang door. Okay
Okay,
lang.
okay.
Ah, sige, sige. Okay. So, kaning aircon, ma'am, okay lang? Natugnawan ko or dili?
Okay lang, okay lang.
Okay lang, Jod. Imuhang paglingkod dira, ma'am. Okay, lang?
comfortable ko.
Okay, salamat kaayo, ma'am, ha? So, right now, we are going to assess the body temperature of the patient using the oral method. Okay, ma'am. So, karon, kuhaon na ko imuhang temperature orally, okay? So, this is just an imaginary oral thermometer, okay? So, since I cannot provide and also I don't have the specific thermometer for the oral method, I will just explain and imaginally demonstrate how this oral method actually occurs. So, before anything else, check first the client's readiness for the procedure. Smoking, eating, or drinking a hot or a cold beverage can alter the reading. In these cases, the route for the temperature taking must be changed or wait for 20 to 30 minutes before taking the oral temperature. So ma'am, may I ask lang ma'am ha, if nag-inom ba ka before going here, or nag-inom ba ka tugnaw or init nga tubig?
Wala, tap water lang.
Okay, that will be good, ma'am. So, now, we need to sanitize this imaginary oral thermometer. So, using a wet cotton, first sanitize the tip of this oral thermometer to its stem, like this. And then, after the wet cotton, we are now going to use the dry cotton and repeat from tip to stem. Okay, so guys, this is just an imaginary oral thermometer. So place the tip of this oral thermometer on either of the side of the frenulum of the patient, which is located in the mouth, and turns the thermometer on. So also ask the client to hold the thermometer in place with lips closed. Okay, ma'am, so since na-sanitize na ako aning oral thermometer, can you please open your mouth? Okay. Sige. This is just an imaginary demonstration. Okay, ma'am, pwede ni mo gunitan? Okay, thank you very much for cooperation, ma'am. Okay. So, wait for the appropriate amounts of time after the placement. So, electronic thermometers, just like this is just imaginary, will indicate that the reading is complete through a light or a tone. So, we just need to wait for any tone because this is a digital thermometer, ma'am, okay? So, if there will be a tone finally, we can just, can I have that one? Okay, thank you for that. So, now, remove the thermometer and whip the tip or the probe of the thermometer sensor with an alcohol swab from stem to probe thermometer. So, just give me a minute. Okay, so now we're going to use another wet cotton from stem to the tip, and then another dry cotton from stem to the tip. Okay, so now we need to remove any gloves if necessary and perform hand hygiene. Okay, so before that, the temperature is normal, ma'am, okay? Orally normal imong temperature. So now, mag-hand hygiene lang ko para makaproceed sa next assessment. Okay, so the temperature, ma'am, is 36.5, which is normal. And now, I need to record this in the worksheet and recheck the temperature if the recording is within the normal range. This is to eliminate the possibility of inaccuracy. So also washing this thermometer if necessary and return it to the storage location and document the temperature in the client's record example the VS monitoring sheet and compare the temperature measurement with the baseline data or the normal range for age of clients and clients' previous temperatures. Okay? So, ibutang lang ako diri ma'am ha. Okay. So after this procedure, ma'am, this oral method, do you have any other questions?
None so far.
Okay, ma'am. So karon kay kuwaon na po nato imuhang temperature using the other method, which is the axillary method. So maggamit di ay ta karon og digital thermometer and ibutang na ko ni sa imong armpit tapos i-test na ko imuhang temperature and then limpyuhan po nato na using this paper towel. And before we proceed, ma'am, do you have any other questions?
None so far po.
Okay. So, of course, before doing this procedure, we need to have a proper hand hygiene. And using this alcohol, I'm going to sanitize my hands. And then, the first one will be move the gown or sleeve away from the arm and shoulder and raise his arm away from the torso and inspect the axillary area for lesions or perspiration. So now ma'am, need na ko itaas imuhang kaning diri na part sa sanina tapos i-check na ko imuhang armpit kung naay mga samad-samad or singot-singot.
Okay, okay.
Okay. Okay lang ma'am? Sige. Sige, okay. Okay ma'am. So, pat the axilla dry, especially if very moist, and place the tip of the thermometer in the center of the axilla and ask the client to lay the arm over the tip. So, before anything else, we really need to sanitize this thermometer. So use a wet cotton and then first is that we need to rub the tip and then to the stem just like this. This is wet and now this is for the dry and then repeat. Okay, so now I need to turn the thermometer on and then okay. So this procedure is very important because moisture can alter or affect the axillary temperature. So, ma'am, okay lang ma'am kung punasan ako or ikaw na magpunas.
Ako na po punas.
O sige, itap-tap lang ma'am ha.
Okay, okay. Thank you.
O sige. Okay na ma'am. Ingnan ko ma'am ha kung okay na. Okay. Ilabay lang ako ni sa trash can.
Okay.
Okay. So, wind the client's opposite side. And this is to facilitate the reading of the body temperature and free the arm nearest to the nurse for the reading of the other vital signs. So, now, ibutang na nako ma'am ha.
Okay.
Pakitaas lang ko ma'am. O sige. Okay lang ka ma'am no? O sige, i-wait lang nato ni siya ma'am ha. Wait lang. Okay. So, we need to wait for the appropriate amounts of time after the placement, excuse me. And then electronic thermometers will indicate that the reading is complete through a light or a tone. And this is to conserve time and energy while waiting for the time. The nurse can actually assess the other vital signs. So, while waiting for this thermometer to have this sound for the reading, I can actually do the pulse assessment. So, since the thermometer has already its result, okay, so pwede na nakatanggalon, ma'am.
Okay, okay.
Salamat kaayo, ma'am ha. So, imong temperature karon kay 36.9, okay? So, the normal kay, ang normal jud kay 36 degrees Celsius to 37.5 degrees Celsius. So, 36.9 man imo, so under normal ka, okay?
Okay.
So, we need to clean this one. First, remove the thermometer and tell the client her temperature, which is 36.9, and wipe the tip of wipe this tip with an alcohol swab from the stem to the probe in a firm twisting rotation. So just like this. This is wet and this is dry. Okay. So after that, place this to its right position to the packaging, and then perform hand hygiene. Okay. So karon ma'am kay ano na lang ako ha? Sige, salamat. Okay. So the record the temperature reading if in the worksheet and recheck the temperature if the temperature is obviously too high, too low, or inconsistent with the client's condition. So we need to wash the temperature if necessary and return it to the storage location and document the temperature to the client's record. Example, the VS monitoring sheets. So, butang lang ako ma'am ha. Naman kay pangutan na ma'am?
Wala na.
Sige. Sige. Okay ma'am, so karon kay kuwaon na nako imuhang pulso ma'am ha, or this is called assessing the pulse. Okay. So gunitan nako imong arms ma'am, ibutan nako sa table para makuha nako imong pulse rate, okay? Okay. So before we start ma'am, do you have any other questions so far?
Wala na po.
Okay, so if this will be the case, before proceeding with this assessment, of course, we need to have a proper hygiene again. And okay, so now we need to select the pulse points, and normally the radial pulse is taken unless it cannot be exposed or circulated to another body area is to be assessed. So assess the client to a comfortable resting position. So, okay ma'am. Pwede na ko ni gunitan ni mong arm. Ibutang na ko dire.
Okay, sure.
Okay. Sige. So, for you to be informed ma'am, there are 9 sites in assessing the pulse. The first one will be the radial pulse. Kinijud ang normal. The brachial. The temporal. This will be the carotid here. The apical. The femoral, kani diri sa imong private part, dapit. Tapos diri sa likod is popliteal, diri sa likod sa tuhod. Tapos kani sa may ankle nimo na atay posterior tibial. And then lastly ma'am na ato diri sa may ugat sa bone sa imong tiil which is pedal, okay? So now we are going to focus in the radial pulse.
Okay.
So na okay na ba ka ma'am? Okay lang ka?
Okay lang.
Oh, sige. So when the radial pulse is assessed and the client is in the supine position with the palm facing downward, the client's arm rests alongside the body or the forearm rests at a 90 degrees angle across the client. And across the chest rather. So since my client is sitting, so bend the client's we need to bend the client its elbow and then to a 90 degrees angle as you can see, and then support the lower arm on the chair's arm rest, and then extend and flex the wrist with the palm of the hand facing downward or inward. So palpates and counts the pulse, places the first 2 to 3 fingers over the groove of the thumb side of the client's inner wrist and counts for 30 seconds and multiplies rate by 2 if pulse is regular and counts a full minute if pulse is irregular and record the pulse in beats per minute in the worksheets. So now we need to assess the pulse rhythm and volume. Okay. So first ma'am kay kuwaon sa nako imong radial sa okay. Okay, ma'am. So, in 30 seconds, your pulse rate is 40. So, 40 times 2, this will be 80. So, ang normal rate di ay sa pulse will be 50 to 90 for the teens, which is your age. So, 80, normal na siya, ma'am. That will be good. So, okay. So, now we need to compare the pulse rate to the baseline data or the normal range for the age of the client. So, now, we need to relate the pulse rate and volume to the other vital signs of pulse, rhythm, volume to baseline data, and health status. Okay, so now we need to document this one. So, while documenting, ma'am, do you have any other questions?
Wala na.
Okay. So, karon, we are going to proceed in assessing your respiratory rate, ma'am. Okay? So, I'm also going to check how your breathing mechanism actually occurs, or is it normal? So, i-check lang na ko, ma'am. And from this, do you have any other questions?
Wala na.
Okay. So, before we start, prior doing this procedure, of course, we need to perform a hand washing or hand hygiene. I'm going to rub my hands with alcohol and complete respiratory cycle or palpates and counts the respiratory rate. So, of course, ma'am, comfortable ba ka dere? O, sige. So, pwede na kuha ni mong kamot usap.
Okay, sure.
Sige. Place lang diri, ma'am, ha?
Mm-mm.
O, i-check lang na ko yung mga breathing mechanism. Okay. So, count the respiratory rate for 30 seconds if the respirations are regular, but count for 60 seconds if they are irregular. And, of course, observe the depth, the rhythm, and the character of the respirations by watching the movements of the chest. Okay. So, mag-start na ko, ma'am, ha? Normal lang, ma'am. Wala kay buhaton. I-place lang na ko diri, ma'am, ha?
Okay.
Okay, ma'am. So, thank you very much for your cooperation. So, in 30 seconds, ma'am, you have 9 breathing. 1 in and 1 out. That is 9. So, 4 times 2, you have 18. So, sa teens, ma'am, we have 15 to 20 ang range. So, you have normal so far. That will be good, okay? So, during deep respirations, a large volume of air is exchanged during shallow respirations, and a small volume is exchanged. So normally, respirations are averagely spaced and evenly spaced and normal, and respirations are silent and effortless. Okay, so now I just need to document this out, ma'am, okay?
Okay.
So, do you have any other questions?
Wala na po.
So far man, ma'am, normal kaayo imong vital signs, but to check, we need to check your blood pressure, okay?
Okay.
But you have nothing really to worry about because normal man tanan. So, let us proceed with the blood pressure, okay?
Okay.
Okay, ma'am, so today we're going to assess the very last assessment, which is taking your blood pressure today. And also, I'm gonna use this sphygmomanometer or the BP apparatus and also this stethoscope to assess if you really have that normal range of blood pressure, ma'am, okay? So, before we start, ma'am, do you have any other questions so far?
Wala na.
Comfortable pa ba ka, ma'am, or gitugnaw na ka, wala pa?
Okay lang.
Okay lang. O, sige. So, we need to ensure that the equipment is intact and functioning properly and check for the cuff size and leaks in the tubing between the cuff and the sphygmomanometer. So, this is a new sphygmomanometer. So, I have already checked this one. There are no damages and leaks. So, this is now ready to use. And also, this is appropriate for the patient's arm. Okay. So, Make sure that the client has not smoked or ingested caffeine within 30 minutes prior to measurements, because smoking constricts blood vessels and caffeine increases the pulse rates, and both causes a temporary increase in blood pressure. So, ma'am, maasang na ko nag-inom pagkape or nag-smoke ka before
Wala
going.
kaya?
Sige. So, since wala, okay, thank you for that, ma'am. So, okay, first, we need to, before assessing this, we need to have a proper hand hygiene. Okay. And also, we are going to clean this certain apparatuses and of course this one later. So, okay, so positions the clients appropriately, and the adult client should be sitting unless otherwise specified. So both feet should be that on the floor, and the elbow should be slightly flexed with the palm of the hand facing up, and the arms supported off heart level. So expose the upper arm. So this procedure really helps us because legs crossed at the knee results in elevated systolic and diastolic pressures. Okay. So karon ma'am kay, since we need to make sure that your legs are feeling comfortable, pwede ka mo tindog ma'am magbalhin lang ta diri og position.
Oh, sure.
Okay, sige matindog lang ta ma'am ha. Wait lang ma'am. I-change lang na ako ang bangko. Sige ma'am, lingkod na ma'am. Sige. Comfortable na ma'am, dili?
Comfortable na.
Sige. Okay. So, karon, since we have make sure that the client or the patient is in position, so wraps the deflated cuff evenly around the upper arm and locates the brachial artery. So, okay. So now we need to use this BP apparatus. So applies the center of the bladder directly over the artery. So this procedure helps us to determine that the bladder inside the cuff must be directly over the artery to be compressed if the reading is to be accurate. So, ibutang lang na po ma'am ha. Pwede niyo mo, wait lang ma'am. Pwede niyo ibutang din mong
Sure.
Sige. Ikuan lang ako imong sanina ma'am ha.
Okay.
Sige. Okay. Ayaw ka bala ka ma'am na reviewhan naman po ni. Ibutang lang ako ma'am ha. So 1 inch jud ni siya sa imong brachial artery. Ikapila naman nini mo nag-BP ma'am?
First time na
Ay,
ako.
first time? Wala din may BP sa inyong balay?
Wala.
As in, sige. Palit na nag-BP ma'am after ani para ma-check po mo ba? Tuduan man po ka.
Okay, sige.
Okay. So if this will be the client's initial examination, just give me a minute. Okay. So perform a preliminary palpatory determination of the systolic pressure. So the initial estimate tells the nurse the maximal pressure to which the sphygmomanometer needs to be elevated in subsequent determinations, and it also prevents underestimation of the systolic pressure or overestimation of the diastolic pressure. And it should always be an Axillary gap occur. So we need to palpate the brachial artery with the fingertips and close the valve on the bulb. So this is now closed, and I'm going to locate the brachial artery. Okay. Okay. So pump up the cuff until you no longer feel the brachial pulse. Note that the pressure on the sphygmomanometer at which pulse is no longer felt. This gives us an estimate of the systolic pressure. So release the pressure completely in the cuff, and wait 1 to 2 minutes before making further assessments. So it is because a waiting period gives the blood trapped in the veins in time to be released. Otherwise, false high systolic readings will occur. So, okay ma'am, buhaton na nako ni ma'am ha.
Okay.
Ina ko ma'am kung comfortable ka. Okay. Sakit ma'am? First time man kayo niyo masay feeling.
Okay lang po.
Okay lang. Sige. Okay. Okay. So now we need to position that stethoscope appropriately. So cleanse the earpiece with antiseptic wipe and insert the ear attachments of the stethoscope in my ear so that they can feel slightly forward. So the function of this will be sounds are heard more cleanly when the ear attachments follow the direction of the ear canal and ensure that the stethoscope hangs freely from the ear to the diaphragm. And this is because if the stethoscope tubing rubs against an object, the noise can block the sounds of the blood within the artery. So, okay. So, limpyohan lang sa anak ko ni Ma'am ha. Wait lang na ako'y kuwaon. Okay. Ayaw ka bala ka ma'am kay ginalimpyohan ako ni. So, kailangan dyan ni siya, ma'am, kanang lahi dyan ni siya na cotton, each, skanipod. Okay lang ka dira, ma'am?
Okay lang po.
Sige, first time man yun ni Karin. So, after ani, asa man ka?
Wala yung balay.
Sige. Okay. Okay. So, now, we need to place the bell side of the amplifier of the stethoscope over the brachial post sides because the blood pressure is low frequency sound and it's best heard with the bell-shaped diaphragm. So, place the stethoscope directly on the skin, not on the clothing over the sides. This is because for us to avoid noise made from the rubbing from the amplifier against the cloth. So, hold the diaphragm with the thumb and the index finger. So, this will be the brachial location. Okay. So, wala may cloth diri ma'am noog. Okay lang ka?
Okay lang.
O imong legs ma'am. Okay
Okay
lang? Okay, sige. So, now we need to auscultate the client's blood pressure. So, pump off the cuff until the sphygmomanometer or reads 30 millimeter of mercury above the points where the brachial pulse disappeared. So, a while ago it was 180, so plus 30 we'll be having 210. So, release the valve on the cuff carefully so that the pressure decreases at the rates of 2 to 3. So, okay. Sa'yo mo na feel, ma'am?
Okay lang.
Sige. Okay. Sige. So, okay. So, if the rate is faster or slower, an error in measurement may occur. So, as the pressure falls, identify the sphygmomanometer reading at Korotkov phase 1. So, just a quick recap. First, the tapping sound heard during the deflation of the cuff. So, and the Korotkov phase 4 is the first diastolic blood pressure, the time when the sounds become muffled and have a soft blowing quality. And Korotkov phase 5, which is the second diastolic BP, the pressure level when the last sound is heard. and this is followed by a period of silence. And the purpose of this is that there is no clinical significance to phase 2 and 3. And now deflate the cup rapidly and completely and wait 1 to 2 minutes before making further measurements. And this is because this permits blood's trap in the veins to be released, and repeat the steps to confirm the accuracy of the reading. Specifically, it falls outside the normal range if there is greater than 5 millimeter of mercury difference between the two readings. Additional measurements may be taken, and the results average. Okay, so if this will be the client's initial examination, repeat the procedure on the client's other arm, and there should be a difference of no more than 10 millimeter of mercury between the arms. So now we need to remove the cuff from the client's arm. And okay, ma'am, so tanggalan na nako, ma'am, ha. And by the way, your blood pressure is 110/70, which is normal, ma'am. You have good, ma'am. You are good. You have healthy vital signs. And of course, just to mention, ma'am, na magkaon kag dagag prutas o gulay to maintain your normal blood pressure, kasi kung mag-increase yan, pwede ka magka-hypertension 1, which has, like, the normal is 120/80. And then, if your next assessment here, magkaroon ka ng 130/85, that will be the hypertension 1. But for the hypertension 2, ma'am, the second hypertension, we will be having like 140 to like 95/95. So this will be like, you need to really to have an assessment for that. And of course, ma'am, we also have like the hypertensive. We have the 180/125. This is very crucial, and you really need to have exercise because this is blood pressure. But you have nothing to worry about that, ma'am, because you have a good vital signs. Please keep it up. And okay, so after wrapping the cuff with an approved disinfectant, so I'm just going to sanitize this one, and just give me a minute, ma'am. Okay. Okay, so after all of this, we need to document and report pertinent assessment data according to the agency policy. So, i-check lang na po, ma'am, ulit. Actually, ma'am, you can na.
Okay, thank you.
Sige, wait lang, ma'am, ha. So far, ma'am, good imong vital signs, ma'am, ha. So, please drink a lot of water, eat fruits and vegetables, ma'am, okay?
Okay.
Pero pag naaman kay ma-feel, please go here so that we can have another assessment so that we can check your vital signs again, ma'am, okay? Okay. So, this will be the end, ma'am. Thank you very much for your cooperation, ma'am, okay?
You're welcome.
So, kung gusto lang nimo magpa-check up sunod, please give us a call back, ma'am, okay? So that we can assist you further. And also, ma'am, do you have any other questions so far?
Wala na po.
Okay, so if this will be the case, ma'am, thank you very much for your cooperation, okay? So, again, ma'am, my name is Kenneth Velasquez, your nurse for today. Thank you very much.
You're welcome.